Hi guys, this is Dr. Mirrafati from Mirrafati. I'm really excited about doing this procedure. We're doing a stem cell / PRP and injecting into the hairline. This is for female pattern baldness. Maybe about 10 years ago, maybe even 5 years ago, if you come to me for female pattern baldness, we actually go do hair transplantation. We take a hair and we try to pluck it in the middle. But we found out that actually with female pattern baldness is you actually transplant the hair, some of the hair will fall out, the hair you transplant goes out, and after that, all is said and done, you end up with the same hair. So it really was not as effective. But right now, doing a stem cell therapy and injecting it into this area and following it up with PRP, it's shown really promising result. Now, here we actually have our own stem cell. I'm going to go and I will guide you through the whole process. We're getting a little bit of fat from our abdomen, and we have the stem cell machine that we turn the fat into a stem cell. Let me have the PRP. I already actually got the PRP. We got 2 syringes of these, so this is what we call the liquid gold. And we're going to mix it with the stem cell as well, and then we inject it right into the crown hair. Now remember, this is all the crown as well as the hairline. Now remember, these are all microscopic, so it's not like hair transplantation where you actually put it in and you say, oh, hair is there. Even with hair transplantation, once you put the hair in, the hair falls out and then it regrows back again. Same concept with doing a stem cell / PRP. It's all microscopic, so when we inject it, eventually over the next year, you start seeing a little hair come out. Now the question is, does the hair come out in the area where you actually lost all the hair? The study doesn't show that actually does that. So if you inject the stem cell into, let's say, right here in my forehead or area in my receding hairline that I absolutely lost the hair, you're not going to get the hair coming back there because there's absolutely no follicles there. But if I put it into the thinning area, that's why I said female pattern baldness, where they're actually getting a little bald in the area and they're getting thinned out. So you prevent further regression of hair loss versus actually hair growing out of places you already have lost. So it's a really good idea for female to see female pattern baldness and they're getting thinned out before they actually lose all the follicles, to come in at the least part, just inject this liquid gold, which we call PRP. But if they really want to advance it up, to actually inject the stem cell and PRP, and that has shown a lot of promising results. So we're going to guide you through the whole thing, from the fat harvesting to cleaning it to putting the stem cell machine and mixing it and injecting it, and hopefully this will clarify the procedure for you. Okay guys, so we harvested the fat. This is our fat. We actually centrifuged it. We put it in this shaker and baker. You can see he's already did the shaking and baking. And now we're at the final stage of it, that we're going to take these off, and then we're going to do another centrifuging. And then we're going to clean this out. And basically this is where all the good stuff is at. So we really don't need the fat anymore. We sort of shaked off the stem cell from this fat, and we're going to wash this off and do another couple more centrifuging, and we're going to end up with the good stuff at the bottom of this this syringe right here. And I'll show you at the end what we got. Then we mix it with our PRP, and then obviously we're going to inject it into the hairline. Alright, so this is our almost the final stage of our basically our stem cell making, and you can see this is our stem cell machine, and we're on the 3rd stage right now, and then we sort of started, and then we wait another 5-10 minutes. Okay, so stay with us. Okay, so this is the completed stem cell / PRP and the SVF that we took out at the beginning. So this has all the stuff. This is the ultimate gold, basically fluid that we can inject, and this is the remainder of that PRP. So we still have some PRP left. We don't want to put it too much in here to mix it up, but I'm still going to use this too and put the remaining right into the hairline. But this is the combination of the PRP and the stem cell mix. So this is it, and then we're going to inject it. The patient actually decided to do pump PRP in her face too, so we drew extra 2 syringes, and we're actually going to do right around her face, around the nasolabial line and other stuff for facial rejuvenation. But we're not doing the stem cell in the face, we're just doing the stem into the hair. Alright, so we'll follow it up in 6 months, see what the results show.